Welcome back to Vets. Before I discuss bone fractures, I will explain more about emergency first aid. At the veterinary clinic, we use the Dr. ABC's action plan that prioritises the order of life-threatening conditions. If you are faced with an emergency first aid situation with an animal, you can also apply Dr. ABC's in the following way. Danger. Are you or the animal at risk from further injury from road traffic? Is the animal extremely aggressive? Are there any other hazards such as broken glass, deep water, possibility of a building collapse or landslide? Response. Is the animal responding? Are their eyes open or closed? Are they conscious and responding to your voice or touch? Airway. Is the animal's airway blocked? Can you safely check inside its mouth for any blockages? If there is and you can remove it safely, do so, but take care not to push anything further down the throat. Breathing. Look and listen for signs of respiration. Is the animal's chest rising and falling? Can you feel breath coming from the mouth or nostrils? Circulation. Can you feel a heartbeat by gently placing your hand over the animal's chest? Can you hear it with your ear? Can you feel a pulse? The best area to check for a pulse could be the medial, meaning the inside of the thigh, towards the groin where you will find the femoral artery. Send. Shout for help if you need it and call the veterinary clinic immediately. Most of all, stay calm and try not to panic. There are veterinary emergencies that require immediate attention. We use a triage process to evaluate each case, with life-threatening conditions receiving priority treatment. Medical emergencies include dyspnea, which means breathing difficulties, which could be caused by a foreign body in the throat, such as a piece of a stick or a ball, or from infections, poisoning or damage to the lungs. Severe bleeding from a wound or orifice such as the nose, mouth, ears, eyes or genitals requires emergency medical attention. Conditions such as sudden heart failure, infections, injuries from road traffic accidents and poisoning can cause an animal to fall or become unconscious. When an animal is unable to urinate, it could be a sign of renal failure, which suggests the kidneys have been impaired. If an animal is extremely weak, unable to balance or bear weight, it could be due to severe dehydration, head, neck or spinal trauma, or nerve, joint or bone diseases or injuries. Depending on the type of break, bone fractures may or may not be visible. There could be a bone poking through the skin, as well as visible swelling or deformity of the limb. In the next slide, I will discuss how we care for a cat with a bone fracture. A male cat has fallen awkwardly from a low garden wall, is limping and not bearing weight on its left front leg or the forelimb. The owner has called the veterinary clinic. The veterinary nurse will perform telephone triage, discuss the cat's current condition and check if the cat has clear airways, is breathing and responsive. If there are concerns, the veterinary nurse will keep the conversation short, as any delay may endanger the cat's chance of survival. The veterinary nurse will take note of any obvious symptoms that a fracture may present, such as limping, not bearing weight on the injured leg, swelling, the cat crying or vocalizing, trying to hide and not wanting to be touched, and we will plan for the cat to come into the clinic as soon as possible. The sooner a fractured limb is treated, the more likely it is to recover successfully. The veterinary nurse will take the owner's contact details, the cat's age and medical history. The owner is advised to carefully place the cat in his cat carrier, taking care not to make the injury worse or more painful by any sudden movements. Handling the cat can be done using a clean towel or blanket to wrap around the cat and using one hand under the cat's head and shoulders with the other hand under the cat's pelvis to support the head, neck and back. It is important to keep the cat warm to help prevent shock and keep the cat as calm as possible. The veterinary clinic will then prepare for the cat's arrival. Vets follow the Royal College of Veterinary Surgeons, the RCVS Code of Practice, and the Veterinary Surgeons Act 1966, which includes providing a 24-hour emergency service. We have this in place, along with an emergency treatment room, operating theatre, emergency medications, in-house laboratory for analysing samples such as body fluids, and we work aseptically, which means we strive to prevent infections and cross-contamination by ensuring our environment and equipment is kept as sterile as possible. On patient admission, paperwork is ready, and the owner is asked to sign consent forms for permission to treat the patient, which includes anaesthetics and surgery. The triage nurse performs a primary assessment on the cat, ensuring his airway is clear, he is breathing well, and has a regular strong pulse and heartbeat. If there are concerns, the veterinary surgeon will be called through to assist. The next slides explain more about the primary assessment. The cat's primary assessment is done by comparing the results alongside the normal health ranges expected in an adult cat and the cat's own medical history. Using a stethoscope to listen to the heart, a cat's normal heart rate should be between 100 to 200 beats per minute. This is done by the cat being supported and standing as shown here, or if the cat cannot stand, being laid in lateral recumbency, which means on its side. The stethoscope has two earpieces that fit into each ear of the nurse, and the diaphragm, which is the round metal end of the stethoscope, is placed towards the left side of the cat's sternum, which is the chest. Using a stopwatch, the heartbeats heard are counted over 30 seconds and doubled to give the beats per minute. The pulse reading should be the same by checking the femoral artery on the medial side of the hind leg towards the groin, which is the inside of the back leg. Using 2 fingers to press on the artery and counting the beats the same way as the heart rate. We do not use a thumb as it has a pulse rate of its own and will confuse the reading. If the heart and pulse rates are different, there may be issues with the heart and the veterinary surgeon should be consulted. The stethoscope can be moved to the middle of the cat's sternum to listen to the cat's lungs and check the respiratory rate, which should be between 20 to 30 breaths per minute. As this cat is stressed and not in its usual environment, its heart and respiration rates may be elevated. Mucous membranes are good indicators of health issues. Using the gums inside the mouth allows you to see the colour and moisture of the mucous membranes. A healthy colour in cats should be salmon pink with moistness. Dryness suggests dehydration. Some animals may have pigmented mucosa due to the amount of melanin in their skin. It may be difficult to check, so the mucous membranes inside the lower eyelids could be used instead. The colour of mucous membranes is affected by various issues. Pale pink may suggest anemia. Yellow could be liver disease. Blue indicates hypoxia, which means lack of oxygen. Red could indicate inflammation or shock, and cherry red could be from carbon monoxide poisoning. When the mucous membranes are pressed with the thumb, they will blanch, and on release, the capillaries should refill with blood and go back to their original colour. This should take less than 2 seconds. Any longer may indicate the patient going into shock, having heart issues or hypotension, which means low blood pressure. The cat's temperature is checked using a digital rectal thermometer, applying a lubricant before insertion so that it is not painful. The cat will need gentle restraint, and when the thermometer is inserted, it is twisted with the tip aimed at the dorsal rectal wall, which means towards the back of the rectum, avoiding fecal matter, which may give a false reading. After 30 to 60 seconds of holding the thermometer in place, the temperature is red. The normal range for a cat is around 38 to 38.5 degrees centigrade. The cat's gait is checked for any weakness or paralysis by seeing if the cat reacts when parts of the body are touched. The cat's mentation or mental state is observed to see whether he is alert, subdued, semi-conscious or unconscious. The cat's nose, ears and eyes are checked for discharges such as blood or other fluid. The pupils are observed to see how reactive they are to light, as well as the pupils being symmetrical. The thorax and abdomen, in other words the chest and stomach, as well as the genitalia and tail are checked for wounds, swelling, bruising or any unusual hardness which may indicate internal damage. The tail should be able to move independently. Lack of movement may indicate a neurological injury. The cat's limbs will be checked for wounds, swellings, pain and crepitus, which is an abnormal cracking or grinding sound, as well as the range of movement in the joints. The injured forelimb will be carefully examined as to not damage it further. The veterinary surgeon will evaluate the injured limb. In this case, an X-ray is recommended to check for fractures, and there are no other health issues apart from the leg injury. The triage nurse will make a record of all the readings and observations concerning the cat and support the injured limb with suitable dressings before the X-ray. All the equipment used is taken for cleaning and sterilisation, and the owner is consulted before any more action is taken. As the cat is in discomfort, an analgesic, meaning pain relief, injection will be administered by the veterinary surgeon along with a sedative before an X-ray can be performed. The owner has informed staff that the cat had eaten its main meal shortly before the fall, so the veterinary surgeon cannot administer anaesthetic as the cat's stomach is full. It may vomit whilst being under anaesthesia, which could be life-threatening as the cat can choke if the vomit enters the lungs. The veterinary nurse clips small sections of fur from the front of the cat's right foreleg, and after cleaning the area with antiseptic, the veterinary surgeon injects analgesia and sedative medication into the cephalic vein. When the cat is drowsy and comfortable, he is taken to the X-ray room and placed on the X-ray table with the machine directed at the injured limb. Staff must wear radiation-proof clothing if they stay with the cat and maintain gentle restraint to prevent the cat from moving. This helps the machine take clear images of the bones for evaluation and diagnosis by the veterinary surgeon. The veterinary surgeon diagnoses that the cat has a small hairline fracture to the ulna, which is the bone in the forelimb. This is classed as a simple fracture with no complications. The veterinary surgeon advises the owner the fracture should heal in 4 to 6 weeks by being splinted and supported with bandaging. The leg is padded and bandaged before the veterinary surgeon positions the splint in the correct place. The veterinary nurse follows the Robert Jones 3-layer bandaging technique and pads around the splint, followed by conforming bandages and a final cohesive layer of bandaging to add another layer of support and appropriate compression. The nurse will check the dressing is not too loose and slip off or too tight, which could affect circulation. The cat will stay at the clinic overnight. His vital signs will be monitored and recorded to make sure his condition is stable. The veterinary surgeon will administer analgesia at regular intervals to ensure the cat is free of pain. Veterinary staff will give the cat comfort and care, as well as his usual food, water and a comfortable sleeping area with room for a litter tray. It is important that the cat can urinate and defecate normally as soon as possible to ensure his body is functioning normally. In line with RCVS protocols and the Animal Welfare Act 2006, the veterinary clinic ensures that the cat receives the highest standard of care and is kept in a safe, stress-free environment overnight. On discharge from the veterinary clinic, the owner will be given written home care advice and prescribed oral medications for the cat to provide pain relief and antibiotics to prevent infections. A suitable cage or pen that is large enough for the cat to sleep, eat and drink with a separate toilet area is ideal, as the cat needs to rest and not jump on the fractured leg. The cat will wear an Elizabethan collar to prevent him from chewing the dressing. The owner will have to ensure the dressing is kept clean and dry to prevent infections. If the cat cannot tolerate the collar, a softer fabric type, such as this one, or an inflatable donut style can be used. If eating and drinking is difficult, the cat can be hand-fed or the collar can be removed temporarily, as long as the owner stays with the cat to make sure it does not chew or scratch at the dressings. As cats like to groom, regular brushing and grooming wipes can help the cat feel better and provide comfort. The clinic will arrange for regular checkups and further X-rays as necessary. Some cats may need physiotherapy to regain full lymph mobility. This is available in the surgery or through a referral. Hydrotherapy may also be recommended, though most cats will not tolerate being in the water. The veterinary clinic will contact the owner to check on the cat's condition, and the owner can contact the clinic at any time if there are any concerns. Thank you for listening. References follow this slide. Please click on more videos for further well-vet information.